What's going on, family? What's up? What's up? What's up? Today is, I don't even know what today is, so shout out to everybody that's here. Hey, so today is Wednesday, and even though I just said that, we're going to be doing NCLEX questions today, so shout out to everybody that's about to join. Hey, so we're going to go through, we're going to be going through NCLEX questions. So, hey, once you're here, I want to know who you are, where you're from, where you're at in your nursing journey, all that good jazz. So, huge shout out to y'all. Hey, so if you guys are just now joining, make sure you guys smash the like button. Make sure you guys share and make sure you guys follow because first of all, don't be greedy. That's number one. Number two, you never know who's going to need this. You know what I'm saying? So make sure you guys freaking share this. All right. So, hey, once we get a good amount of people up in here, we're going to be going over NCLEX questions and then we're going to do, an Ask Me Anything in regards to nursing or whatever you guys want to know. Once that's going on, then, hey, that's when most people leave because they don't give a damn about anything. They don't give a damn about nothing except for questions. So I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys share, like, and follow. All right. So we got 4 people that are in here right now. Shout out to y'all. Probably give it about another 5 minutes or so. And then we'll see where people are at. And then, hey, if people aren't there, then, whatever. I'll turn around and I'll start doing questions anyway, even if there's nobody in here. So that way nobody can say, oh, my God, I didn't get no questions this week. So I wasn't here on Monday, had some stuff going on. So that's life. Can't be doing TikTok live and TikTok every day. I ain't got to be around y'all every day. You know what I'm saying? So, hey, who are you? Who are you? Where you from? Where you at in your nursing journey? You a pre-nursing student? You taking NCLEX? You in school right now? I know we're in the middle of October, so we're in the middle of the semester for most folks. Did you graduate already? Are you graduating soon? You took the NCLEX? All that good jazz. I want to know. And I want to know down in the comments. And that way, we can all have a really good conversation together. If this is your first time here, my name is Kevin. I've been a nurse for 3.5 years. And I failed the NCLEX 3 times, y'all. I failed the NCLEX 3 times. You want to know why I do these questions? It's because I don't want nobody else to feel like they can't get through this exam. You know what I'm saying? This exam is tough, but it's not like you can't get through it like the other hundreds of thousands and millions of nurses that have gotten through it, since the exam became a thing. All right. So I just want to let y'all know that. But like I said, I want to know who you are, where you're from, where you're at in your journey. What questions do you guys have? As soon as we get a good amount of folks up in here, we're going to do these questions. All right. I got a good amount of questions for everybody. So, hey, make sure you guys share. Make sure you guys follow. All right. Hey, so the more that you share, the more that the algorithm, it does its thing. Make sure y'all smash that like button too. Don't be out there being greedy. You know what I'm saying? We got 30 people, almost 30 folks up in here. Got 36 folks. Okay. Now we climbing, baby. Now we climbing. So hopefully everybody had a really good weekend. I just took my NCLEX today. Shout out to you, Danielle. How do you think you did? It don't even matter how you did. You want to know why? It's because you passed. You smashed that exam. You killed it. All right. Everybody's really scared of that new generation NCLEX, but I'm telling you right now, you don't need to be scared for it. I promise you. If you prepare for anything, just like if you practice a sport, you're going to be prepared for that game. Yeah, it can be intense, right? But I can tell you right now, if you properly prepare for it, which I really truly believe that you did, and like a lot of people do, you're not going to have no problem. All right. Somebody said, did you do the Pearson VUE trick? Hey, so remember about the Pearson VUE trick, okay? It is not official. I have seen people personally do the Pearson VUE trick, show that they've got the bad pop-up and still pass, and vice versa. All right. So you may think that the Pearson VUE trick stimulates and helps with your nerves, but in reality, it could really fuck with you. All right. So you got to be careful with that. But hey, you do that at your own risk. I made videos for that specific reason, but I told people it's just like, it's not official. It's not official at all. All right. Hey, we got 65 folks up in here. Appreciate you guys smashing the likes. Make sure you guys share, follow. All right. I got the good pop-up, so I'm hoping it's true. Like I said, it's a 99.9% chance, but there are those. Hey, remember, it's a glitch in the system. That's all the Pearson VUE trick is. Okay. All right. Hey, we got a good, we got 60 something people up in here. So I think I'll just turn around. I'll turn the camera around and we'll get it on and popping. All right, here we go. All right, there we go. Hey, so we are going to be doing NCLEX questions. Hey, participation. Hey, participation is the key. All right. You have to participate. I need y'all to give me these answers. All right. So participation is the key. Give me all them likes. Make sure you guys smash the like button. You guys share. You guys follow. Don't troll my chat. If you troll my chat, I'm going to ban that ass. And so don't be rude to me or don't be rude to nobody else. Don't rush me either. Because if you rush me, you just going to sit that ass here and wait. All right. I don't gatekeep. I got these questions off nurselabs.com. You guys can go over there and check them out. They actually just updated their questions just recently. Also, 7-day NCLEX course is still in this pre-launch. Right now, if you get it for $48. Currently, I have 42 content videos in there, and I am currently recording the NGN review, which consists of over 100 questions and me breaking them down, so on and so forth. That link is in my bio. Also, you need one-on-one coaching like with the NCLEX, you can book a 15-minute call. That link is also in my bio, so you guys can go over there and check that out. All right, without further ado, here we go. And I'm going to put y'all on a stopwatch timer too, so don't be playing with me. All right, here we go. Hey, so Nurse John is caring for a client in the outpatient clinic. Which of the following phone calls should the nurse return first? So based off of that, I'm thinking first or most or anything like that. That's telling me it's a priority question, right? Type of management of care, like who do I call back first? Who do I see first? Some type, right? So is it a client with hepatitis A who states my arms and legs are itchy? Is it B, a client with a cast on the right leg who states I have a funny feeling in my right leg? Is it C, a client with osteomyelitis of the spine who states I am so nauseous that I can't eat? Or is it D, a client with rheumatoid arthritis who states I'm having trouble sleeping? We got B, we got two. To what? To what? To you? Oh, okay, I got you. It's B. I got you. Shout out to all 130 plus of y'all up in here. Hey, make sure you guys like, share, smash that like button, share, and give me a follow because, you know, kind of cool. I'm going to give y'all 10 more seconds. All right. I want to know who you are, where you're from, where you're at in your nursing journey. All right. All right, here we go. Most people are saying B. Chrissy says C. Okay. Is it Aya says B? JC says C. All right, here we go, y'all. Here's our answer in 3, 2, and obviously, Kevin, get it together. And the answer is B, a client with a cast on the right leg who states, I have a funny feeling in my right leg. That is telling me that it may indicate a neurovascular compromise. So it requires immediate assessments. Yeah, so it could be a clot, but if I just put a cast on somebody, the cast could be too tight. So if it's too tight, what does that tell me? I love how it shows up right after I pass. That's what I'm talking about, Moon. That's what I'm talking about. What's up, friend? Hey, everybody, give Nurse Cass a shout out. She's one of my moderators. Hey, she's been a nurse for almost 20 years, and she will fight you. All right, so here we go. No circulation. So what is that called? Airway breathing circulation comes first of all. Everything. What about level of consciousness? What about an altered level of consciousness? Would that become? There you go. Compartment syndrome. Thank you, Destiny. Appreciate you. All right, here we go. On to the next one. Appreciate y'all. Hey, question number 2. Nurse Sarah is caring for a client on the surgical floor and has just received a report from the previous shift. Which of the following clients should the nurse see first? All right, so this is sounds like another management of care question for me. I'm a flight medic from Maine. I may do nursing school shortly. Love these lives. Appreciate you, Charlotte. Appreciate you. Shout out to all the flight folks out there. I love my flight folks. Is it A, a 35-year-old admitted 3 hours ago with a gunshot wound with a 1.5 centimeter area of dark drainage noted on the dressing? A 43-year-old who had a mastectomy 2 days ago has 23 mLs of serosanguinous fluid noted in the JP drain. Is it a 59-year-old with a collapsed lung due to an accident? No drainage noted on in the previous 8 hours. Or is it a 62-year-old who had an abdominal perineal resection 3 days ago, complaining of chills? We got D. Let me see. I know that's kind of weird. I'm going to back this up because for some reason I can't see it. So, all right. We got D. Shout out to all 130 y'all. Appreciate y'all. Who is it? Whoish? Or who is, what is it? Hija? You got to give me one. Make sure you guys like, share, follow. The shares and the follows go a long way. So I think it's C. Okay. And if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Shout out to you starting med-surg, Miss Unique Spain. Okay. All right, I'm going to give y'all 10 more seconds. Appreciate the follow. Is it Lex? Appreciate the follow. You're in South Carolina? Shout out to South Carolina. Graduated last year. Shout out to you. You're in med-surg now. It's okay. Is it Desi? Hey, don't cry about it. You just got to get through it. All right, y'all. Here we go. It's Daphne. I'm in my first semester taking Funds and Farm. Hey, Funds and Farm, literally, this is going to sound really cliche, but Funds and Farm is what you need. I'm telling you right now, pharmacology is a monster. All right, here we go. Here's our answer in 3, 2. And the answer is D, a 62-year-old who had an abdominal peritonitis should be assessed for further symptoms and infection, right? Because they had, 3 days ago? So now they're exhibiting signs and symptoms of possibly having an infection, okay? Septic shock. There you go, Charlotte. Preparing for my NCLEX. Shout out to you. Is it Charisse? Shout out to you. All right, here we go. Just passed my NCLEX yesterday, getting ready to start in a critical access ER in a few weeks. Sam, shout out to you. You're going to rock that job. It says working prereqs, then we'll be petitioning to go into nursing school. Shout out to you, Jackie. Shout out to you. Nurse 10 years, currently MP school. All right, Lauren, we see you out here. Miss Big Money. Big Money, Lauren. No, let me stop. All right, here we go. Question number 3. Nurse Eve is caring for a client who had a thyroidectomy 12 hours ago for the treatment of Graves' disease. The nurse would be most concerned if which of the following was observed. Blood pressure 138/82, respirations 16, oral temperature is 99 degrees Fahrenheit. Client supports his head and neck when turning to the left. When turning his head to the right. The client spontaneously reflexes his wrist with the blood pressure is obtained. And the client is drowsy and complains of a sore throat. We got C's, okay. Trousseau's, okay. I see you in California. Just passed my NCLEX on 9-2. Shout out to you, Brandy. Shout out to you. Hypocalcemia, okay. Prereqs and LP in school. Shout out to you, Christy. Shout out to all 127 of y'all. Hey, if you guys are new here, make sure you guys like, share, and follow. Smash that like button. Hey, I want at least like 50,000 likes. I know y'all ain't greedy out here. 10 seconds. I need like 50,000 likes. I need for y'all to follow. Take my NCLEX Monday. Shaney, shout out to you. Ma'am, on Sunday, I don't need you doing nothing out here. You need to be relaxing. You need to be relaxing. All right, cool. Here we go, y'all. Here we go. Here's our answer. In 3, 2, and the answer is C. So here's the one thing. When you guys are studying questions or any type of question, doesn't matter what your profession is that you're always going to get an answer. You're always going to get a rationale. Lord, I hope you're getting a rationale, right? And then when you read your rationales, you read the correct one, which is the one that's in red, and then it'll give you the rationale under it, usually depending on what you have. And then you read your rationales for why these are incorrect. Okay. So, carpal spasms indicate hypocalcemia, and you're thinking about Trousseau's sign. Sunday is your birthday. Hey, celebrate your birthday, but don't go out there going crazy. I'm just saying. All right. Here we go. Question number 4. Julius is admitted with complaints of severe pain in the lower right quadrant of the abdomen. Now paint the picture. What is in your lower right quadrant of your abdomen that we're going to be looking for? To assist with pain relief, the nurse should take which of the following actions? Encourage the client to change positions frequently in the bed, administer Demerol 50 milligrams IM, Q4 hours, and PRN, apply warmth to the abdomen with a heating pad, or use comfort measures and pillows to position the client. Minus Thursday. Okay. Oh, I was talking about birthdays. That's what. Hey, Scorpio season's right around the corner. So I need for y'all to stop playing with me, and I need for y'all to answer these questions. You know what I'm saying? So, shout out to y'all. We got D. People giving. Okay, I'm getting D's out there. All right. Shout out to all 230 of y'all in here. If you're new here, my name's Kevin. We're going over NCLEX questions. All right. Make sure you guys like, share, follow, smash that like button, share, because you never know who's going to need this. You know what I'm saying? Don't be greedy your whole life. And make sure you guys follow, because, you want to be friends with me or whatever you want to do. 10 seconds. 10 seconds. We got D. Laura, thank you for the follow. Nurse, is it Hux? Thank you for the follow. Micah, appreciate the follow. Monica. No, Monica. All right, now I'm done. Done with my jaw rule. Here we go. Here's our answer in 3, 2. And the answer is D. Use comfort measures and pillows to position the client. Using comfort measures and pillows to position the client is a non-pharmacological method of pain relief. So we always want to do the least invasive to the most invasive. Okay. So, and that's another thing. Think about it. What's in our, there you go, least invasive first. So also think about this is what type of issue is going on with a patient who has lower right abdominal pain, appendix, right? So I could be thinking about appendicitis, right? Or, inflamed appendix. And if it's depending on whatever imaging and CT scan says, that thing coming out. Appendicitis maybe, yep. Right? Hey, remember, usually with appendicitis or cholecystitis or cholelithiasis, you got to get imaging. You got to get some type of CT scan in order to know. hey, that this is enlarged or so on and so forth. But there's those classic clinical signs that you'll see. Okay. So here we go. Question number 5. Nurse Tina prepares a client for a peritoneal dialysis. Which of the following actions should the nurse take first? What is the very first thing I want to do? Do I want to assess for bruise and a thrill? Warm the diacylate solution, position the client on the left side, or insert a Foley catheter? We got B's. Kaylee gave me hearts, so I'm guessing that's I don't know what that is. I don't know what a heart is. Is it a B? We'll go with that. Yo, what? It says C. Shout out to all 300 of y'all. If you guys are new, we're doing NCLEX questions. Make sure you guys give me a like. Make sure you guys smash that like button. Give me a follow, and make sure you guys share. Don't be greedy your whole life. 10 seconds, y'all. 10 seconds. We got an A over here. A peritoneal does not have access like hemodialysis. No bruit and thrills for PD. Okay. Appreciate it. It was Melanie, Amy, and Margot. Thank you. Melina, appreciate you. I don't think we've learned this yet. That's okay, because you finna learn it right now. Okay? All right, I'm done. Let me stop being passive aggressive. I love y'all. Appreciate y'all. Here we go. Here's our answer in 3, 2. And the answer is B. Warm the diacylate solution. Cold diacylate increases discomfort. The solution should be warmed to body temperature in a warmer or heating pad. Do not use the microwave. Just saying, bruh. It says, bruh, y'all better be warming that solution. Otherwise, cramps. You better let them know. You better let them know. You better let them know. Hey, so that is usually, so depending on whatever you guys decide that you guys want to get to study for yourself, the rationales will be this short or they'll be that big. But make sure you read them and then understand why these are correct and know what section it falls under. Physiological adaptation, which is the 3rd largest section on NCLEX. Okay. Oh, man. Camille's here. Oh, Lord of mercy. Lord of mercy. All right, here we go. Hey, real quick, here's a break time. Hey, NCLEX questions, that's what we're doing. Make sure you guys participate. Make sure you guys smash that like button. Give me all them likes. Don't troll my chat. You troll my chat, I'm going to ban you. I got these questions off nurselabs.com. You guys can go over there and check them out for yourself. 7-day NCLEX course is what I created. It's in its pre-launch. You get it for a lifetime for $48 right now. Once you get it, it's yours forever. And then, hey, if you need coaching or anything like that for the NCLEX, you can book a call. You can check that out. That link is in the bio as well. Here we go. Commercial break. Hey, if you like the commercial break, hey, give me thumbs up. Let me know if you like them. Hey, I literally just had almost 400 people in here and almost over 100 people just left. They're just like, I don't give a fuck what you got to say, guy. Just give me the questions. Oh, man. All right, here we go. Question number 6. Is it Nurse Jana? I know what Jana. She teaches an elderly client with right-sided weakness on how to use a cane. Which of the following behaviors, if demonstrated by the client to the nurse, indicates that the teaching was effective? So what's our topic? It's, proper, like using proper assistive devices, right? And based off of the teaching, what was done that was correct, right? So is it A, the client holds the cane with his right hand, moves the cane forward, followed by the right leg, and then moves the left leg? Do they hold the cane on the right hand, moves the cane forward, followed by the left leg, and then moves the right leg? Do they hold the cane in the left hand, moves the cane forward, followed by the right leg, and then moves the left leg? Or is it D, the client holds the cane in the left hand, moves the cane forward, followed by the left leg, and then moves the right leg? House is wrong. You damn right House is wrong. He be doing it wrong all the time. And it's recorded, so there's no going back from that. Shout out to all 200 plus of y'all in here. Shout out to all 200 plus of y'all in here. Make sure you guys like, share, and follow. Smash that like button, y'all. And make sure you guys follow and share. Follow because, I guess I'm cool, whatever. I'm out here being controversial because some folks don't like it, but that's okay. I'm going to give y'all 15 seconds. Ashley, thank you for the follow. Show us the answer. I'm not showing you nothing until I said after 15 seconds, ma'am. We ain't on your time, we on mine. What the hell you think this is? My God. Y'all so impatient, like y'all got somewhere to go. All right, here's our answer. We got some D's and some C's. All right, here we go. In 3, 2, and the answer is C. All right. The client holds the cane with his left hand, moves the cane forward, followed by the right leg, and then moves the left leg. The cane acts as a support and aids in weight bearing for the weaker right leg. So this is part of the health promotion and maintenance. So also you gotta, if you need to, go and look up how to move with assistive devices. Taylor says, I take my, this was on my test Monday. Shout out to you, Taylor. Shout out to you. Who said that they love my channel? Unique. Look, I'm just letting you know. Don't be coming over here trying to not you, but come over here trying to tell me to rush. The hell you think this is? But I love y'all. Irene, thank you for the follow. Shay, it's whatever your name is. Thank you for the follow. All right, here we go. Question number 7. An elderly client is admitted to the nursing home setting. The client is occasionally confused and her gait is often unsteady. Which of the following actions, if taken by the nurse, is most appropriate? So now we're talking about a safety issue, right? Where she has a decreased level of, a cognitive issue with memory, always confused, and she has a weakened gait. So now we're talking about a safety issue. So is it A, ask the woman's family to provide personal items such as photos or mementos? Is it B, select a room with a bed by the door so the woman can look down the hallway? C, suggest the woman eats her meals in the room with her roommate? Or is it D, encourage the woman to ambulate in the halls twice a day? Is it Kaylee or Kayla? Thank you for the follow. Appreciate you. We got A's, we got D's. I'm gonna give you guys 20 seconds. Let me give you guys A. So we like to, when you guys are going through these questions, when you guys are studying for NCLEX, hey, give yourself at least 60 seconds to answer this question, no longer than 90 seconds. And at the total extreme, no longer than 120 seconds, okay? 5 seconds. So we got some A's, we got some D's. Pictures can be reoriented. Yeah, okay, I see you. All right, y'all. Here's our answer. In 3, 2, and the answer is A. Ask the woman's family to provide personal items such as photos and mementos. Photos and mementos provide visual stimulation to reduce sensory deprivation. And so whoever said that, it kind of helps reorient them, based off of the pictures for somebody who may be having dementia or signs of Alzheimer's. I was about to say autism, but Alzheimer's. It actually can help redirect them. Okay. So shout out to y'all that got that right. Physiological adaptation, 3rd largest section on the NCLEX exam. Both exams. Hi, any HESI prep recommendations? The Mometrics book, and it's a trivium book you can look up, and it's on Amazon. They're like $33. So, all right, here we go. Question number 8. Nurse Evangeline teaches an elderly client how to use a standard aluminum walker. Which of the following behaviors, if demonstrated by the client, indicates that the nurse's teaching was effective? The client slowly pushes the walker forward 12 inches, then takes small steps forward while leaning onto the walker. The client lifts the walker, moves it forward 10 inches, and then takes several small steps forward. The client supports his weight on the walker while advancing it forward, then takes small steps while bouncing on the walker. Or is it D, the client slides the walker 18 inches forward, then takes small steps while holding on to the walker for balance? So we got B's and some C's and some D's. Mostly B's and C's. Taylor says C for sure. Okay, Taylor. All right, I hear you, girl. I hear you. Khadijah says C. Every time I see your name, Khadijah, it just reminds me of Living Single, and I just want to sing it. Mostly it's because my ADHD just be trying to take over, and that's not what y'all here for. Y'all ain't here to listen to me sing that. So I'm going to give y'all 10 seconds. Nisi says D. Okay. Shout out to everybody that's in here. All 200 plus of y'all. Make sure you guys like, share, follow. Smash that like button, share, and follow. Because you never know who's going to need it. And don't be greedy your whole life. All right, here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is B. The client lifts the walker, moves it forward 10 inches, then takes several small steps forward. A walker needs to be picked up, placed down on all legs, then patient can move. Ashlyn said, yeah. Is it Zariah? Thank you for the follow. Crystal, thank you for the follow. Miss Stevens says, awesome. That's what I'm talking about. Clap hands. That's what I'm talking about, Courtney. 10 inches. 10 inches. All right, I'm done. Next question. Here we go. Question number 9. Nurse Derek is supervising a group of elderly clients in a residential home setting. The nurse knows that the elderly are at greater risk of developing sensory deprivation. For what reason? Is it A, increased sensitivity to the side effects of medication? Is it D, decreased visual, auditory, and gustatory abilities? Is it C, isolation from their families and familiar surroundings? Or D, decreased musculoskeletal function and mobility? Appreciate the shares. Hey, if you're new here, make sure you guys smash the like button. Make sure you guys like. Make sure you guys share. And I want to know who you are, where you're from, where you're at in your nursing journey. I don't care if you're a pre-nursing student in school right now, struggling like we all struggled as nurses, while we were students. You graduating, NCLEX, you've been a nurse for a while, let us know. Let us know. 10 seconds, y'all. 10 seconds. Appreciate the follow. Thank you. Semester 3 struggle. I take my NCLEX next week. Shout out to you. I'm a social worker. Ew. No, I'm just playing. I love social workers. I'm not even gonna lie to you. They're great. LP in here, back in school for RN. Hey, I just want to let y'all know all of my MAs, all of my CNAs, my techs, my LPNs. I love y'all. Straight up. Courtney's a nurse. Appreciate you. I love all of y'all. I don't care what motherfuckers say, and I don't appreciate how motherfuckers treat other people. I can't stand it. I want to be a nurse. Hey, there's a difference between want to be and making it happen. So you want to be it, you better make it happen. All right, y'all. Here's our answer. In 3, 2. Kayla says she graduates with her BSN in May. Shout out to you. All right, our answer is B, decreased visual, auditory, and gustatory abilities. Gradual loss of sight, hearing, and taste interferes with normal functioning. That is me, because I'm old as fuck right now. That's how I feel. Wouldn't be anywhere without CNAs. That's facts. All right, here we go. Question number 10. Take my NCLEX November 1st. Shout out to you, Kenzie. Shout out to you. Do you need... I didn't even see what you said. Here we go. Question number 10. A male client with emphysema becomes restless and confused. So what does that tell me about his thought process? So what about, what is his level of conscience, right? What step should Nurse Jasmine take next? Encourage the patient to do pursed lip breathing, check the client's temperature, assess the client's potassium level, or increase the client's oxygen flow rate. So what are we thinking? Who said something about how I start being a nurse? I'm an MA. Well, I don't know. There's this little thing, and I ain't trying to be an asshole, but there's this little thing called Google where you can look up everything. Literally everything. We got some D's, some C's, and A's. I'll give y'all 15 seconds. But seriously, honestly, just Google. Look up, there's certain things that all you got to do is look up how to be a nurse. Here's a really good one. Nurse.org. They have all different types of information on there on how you can become a nurse. You just need to figure out what school you want to go to, so on and so forth. And then what those school prerequisites consist of, you name it. You'll get all that information out there. All right. Got some A, C, D. Is it Everjoy? Thank you for the follow. You're welcome. All right. Hypoxia. Okay. All right. Here we go, y'all. Here's our answer. In 3, 2. And the answer is A. Encourage the client to perform pursed lip breathing. Pursed lip breathing prevents the collapse of the lung and helps client control the rate and depth of breathing. Yeah, you got A. T-baby. T-baby. All right, I'm done. Sorry, but yo. Oh, we got the answer right, y'all. Y'all got the answer right. So shout out to y'all. Appreciate the follows. Make sure you guys like, share, follow, smash it. Smash those buttons. All right. Hey, so real quick break. We're doing NCLEX questions. Commercial break. Make sure you guys participate. Smash that like button. Make sure you guys follow. Give me all them likes. Don't troll my chat. Well, my time, not yours. Nurselabs.com. That's where I got that is where I got the questions from. So you guys can go over there and check that out for yourself. Also, 7-day NCLEX course. That's an NCLEX course I created. It's in its pre-launch phase. Right now, you get it for $48 for a lifetime. It's not on a subscription, and the link is in my bio. Also, if you need one-on-one coaching or tutoring with the preparing for the NCLEX, you can book a call. That link is also in my bio. On to the next. All right, here we go. Question number 11. Randy has undergone a kidney transplant. What assessment would prompt Nurse Katrina to suspect organ rejection? Is it sudden weight loss, polyuria, hypertension, or shock? Where baby boot at? Oh, he quiet, ain't he? Hey, look, you already know we don't say the Q word around here, but he Q worded up. So we ain't bringing him up in here. We got D's, we got C's. 15 seconds, y'all. 15 seconds. If you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys smash that like button. Make sure you guys share, because you ain't greedy out here. And make sure you guys follow. All right, give me that follow, because you kind of like me. Who said what she said? She's like, what my wife cooking today, ma'am? Fatima, ma'am. She's cooking KFC bowls. You already know what the deal is. It's about to be, we're about to be eating good up in here. You know what I'm saying? You're moving to C. Hey, that ain't too far from me. That ain't too far. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is C. Hypertension, along with fever and tenderness over the grafted kidney, reflects acute rejection. Okay. Hey, that is reduction of risk potential, which is one of the smaller, but of course important percentages and sections on the NCLEX. It makes up 1 of 8. Okay. So make sure when you're reading your rationales or why it's correct, and then also why it is incorrect. Okay. Here we go. Question number 12. The immediate objective of nursing care for an overweight, mildly hypertensive male client with your ureteral colic and hematuria is to decrease what? Pain, weight, hematuria, hypertension. I'll give y'all 30 seconds for that. I'll give y'all 30 seconds. We got A's. Hey, if you guys are new here, make sure you guys are following, make sure you guys share, and make sure you guys smash that like button because, you're not greedy out here. You know what I'm saying? You coming to mess, ma'am, don't be coming down here with that foolishness. You already know the deal. Don't do that. Hey, but if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Miss Independent, thank you for the follow. Barbie says D. Joe Henderson. Who is that? AB86. I appreciate the rose. Thank you. All right, y'all. 10 more seconds. 10 more seconds. Kaylin says A. Sister Moon Lotus says D. Okay. All right, y'all. Here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is A, which is pain. Sharp, severe pain radiating towards the genitalia and thigh is caused by urethral distension and smooth muscle spasm. Relief from pain is the priority, right? Taking NCLEX RN in 2 weeks from New Jersey. Shout out to Jersey. Kaylin said, whoop, whoop, damn, I'm finna fail the NCLEX. No, you're not. So here you guys got to realize is that the NCLEX is based off of you and how you answer. So if you answer questions correctly, and you get them right, they're going to give you harder questions. That's the goal of NCLEX, y'all. For all 300 plus of y'all in here, you have to get to the hard questions. Once you start getting the hard questions, I'm just saying. Hey, somebody said they're in Wyoming. Hey, I just want to let you know, I went to the Devil's Tower. That's probably one of the best places I've ever been. How old is too old to become a nurse? There's no such thing. No such thing. Too old to become a nurse would be probably when you're dead or dying. If you really want to be a nurse, you'll make it happen. Age has nothing to do with you being a nurse. At all whatsoever. First semester of BSRN at 39. Shout out to you. I had ladies that were in my class that were in their 50s, early to mid 50s. So I ain't got nothing to do with that. Matilda has hyperthyroidism. Is to receive Lugol's iodine solution before a subtotal thyroidectomy is performed. The nurse is aware that this medication is given to what? And what is its purpose? Decrease the total basal metabolic rate, maintain the function of the parathyroid glands, block the formation of thyroxine by the thyroid gland, or decrease the size and vascularity of the thyroid gland. What are my credentials? I don't got none. I'm just out here, stolen Valorant, to be honest. I have to actually work today. Ma'am, I'm going to need for you to get to work. My son has this disease. Oh, look at you. See, Brooke, you're kind of cheating if your son has it. I'm just kidding. That's dark humor. I don't mean that. I don't mean no disrespect. But hey, you learn off of the things that happen to you in life, right? And so that's how you get it. He's a Florida nurse. Ma'am, I am not a Florida nurse. Don't you ever in your life say that to me again. Oh my God. I hope I am right though. I might not be. Oh, it's okay. It's all good. It's all good. Ma'am, don't be coming out here telling people I'm from Florida. I lived in Florida for 4 years, though. 10 seconds, y'all. C, maybe? Okay, I'm a Florida nurse. Ain't nothing wrong with people being from Florida. You know what I'm saying? Stolen valor nurses. You know what I'm saying? I'm just playing. No, are you an RN, BSN, or MSN? So here's the thing. RN is a license. Your BSN, your MSN, and your ADN are degrees. I have a BSN, and I'm an RN. All right, y'all, here's our answer. All right? In 3, 2, he has his doctorate. Shit, I wish I had my doctorate. Not yet. We getting there, though. We getting there. All right. I feel stressed. Don't feel stressed. The answer is D, decrease the size and vascularity of the thyroid gland. Lugol solution provides iodine, which aids in decreasing the vascularity of the thyroid gland, which limits the risk of hemorrhage while surgery is performed. I take back what I said. Oh, it's all good. It's all good. Hey, that's just why we do this. It's because it's for practice, baby. That's what it's for. We practicing out here. Okay, we practicing. Pharmacology, pharmacological and parenteral therapies, the second largest section on NCLEX. All right, second largest section. All right, here we go. Question number 14. Ricardo was diagnosed with type 1 diabetes. Now think about it. We have two types of well, no, we don't have two types. We have type 1 and type 2. And we have diabetes insipidus, right? So based off of diabetes, what is the not physiological? What is the pathophysiology with somebody who has type 1 diabetes, right? That's where your content really comes into play. The nurse is aware that acute hypoglycemia also can develop in the client who is diagnosed with what? Liver disease, hypertension, type 2 diabetes, or hyperthyroidism. I'm taking patho now. Is it Nicole? Hey, I loved patho when I took it. It was one of my favorite classes. I thoroughly enjoyed it. It says C, type 2 diabetes. D, okay. I'm gonna give y'all 20 more seconds. Hey, if you guys are new here, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow because, you know, I'm kind of cool, but whatever. And I want to know who you are, where you're from, where you're at in your nursing journey. I want to say one of my homies just jumped in here. Jana, are you in here? All right, y'all. Here we go. Here we go, y'all. Here we go. Here is our answer. Here's our answer in 3, 2. And you're a new. Oh, okay. You're a new nurse. Thank you, emo nurse practitioner, for being a new nurse and being in here. Hey, y'all. That's one of my homies right there. I'm just letting you know, homies, straight up. She taught me so much. I love you, Jana. Thank you for being here. All right. So the answer is A, liver disease. The client with liver disease has a decreased ability to metabolize carbohydrates because of the decreased ability to form glucogen. Right, and to form glucose from glucogen. All right, I'm an L&D nurse in Houston. Shout out to H-Town. Shout out to H-Town. All right, appreciate all 400 y'all up in here. Appreciate y'all sharing. Vanessa said, I'm in my first semester of my accelerated BSN program. Ma'am, you go ahead and go out there and rock it. BSN, suspended license, Cape Cod. Ma'am, why? What happened? All right, here we go. Question number 15. Hey, if you guys are new here, we're doing NCLEX questions, okay? Tracy is receiving combination chemotherapy for treatment of metastatic carcinoma. Nurse Ruby should monitor the client for the systemic side effect of what? Ascites, nystagmus, leukopenia, or polycythemia. Hey, I'm from H-Town, radiation oncology. Ma'am, go ahead and answer this question in, girl. Because let me tell you something. I did an oncology lesson, and them things is hard. Them things is hard. Them medications are a monster. They a monster. Appreciate the follow, B. Appreciate the follow. So we got people saying C, okay. K is saying C. 3 C's. She thick with 3 C's. All right, here, like, I'm going to sit on this one. That's okay. That's okay. All right, I'm going to give y'all 15 more seconds. Okay, we got C's. Okay. All right. All right, appreciate the share. Okay, DUI, alcoholic. What? Oh, I'm tracking. I got you. I got you. Any chemotherapy, white blood cells drop, other degrees, the path you take, facts. All right, y'all, here we go. Here we go. Here we go. Here is our answer in 3, 2. And the answer is C, leukopenia. And who said it? With reduction of white blood cells or white blood cell count is a systemic effect of chemotherapy as a result of, myelosuppression, right? Immunocompromised, right? Because everybody that's on chemo, hey, they kill all the good stuff and all the bad stuff, right? Yep, deal with it daily. Look at you, expert Krista out here. Shout out to you, girl. Shout out to you. All right, here we go. Here, hey, physiological adaptation, third largest section on NCLEX, okay? Hey, NCLEX, physiological adaptation, management of care, pharmacology make up the 3 largest sections, 44 to 49%, all right? Hey, real quick, commercial break. NCLEX questions, that's what we're doing. Participating, that's what you're doing. And also giving me them likes is what you're doing. But what you're not going to do is troll my chat or I will ban that ass. All right, nurselabs.com is where I got the questions. 7-day NCLEX course if you need NCLEX courseness. Pre-launch, $48 for a lifetime. Link is in the bio. If you need one-on-one tutoring or coaching, you can book a call with me. That link is also in my bio. All right, appreciate y'all. Love y'all. Make sure y'all like, share, and follow. All right, question number 16. Norma, who with recent colostomy, expresses concern about the inability to control the passage of gas. Nurse Oliver should suggest that the client plan to what? Eliminate foods high in celluloses, decrease fluid intake at mealtimes, avoid foods that in the past caused flatus, or adhere to a bland diet prior to social events. We got C. Somebody said B up there. Okay. Okay. Is it Kaylin says C? Cameron says C. Crystal says C. Amanda says C. Okay. Khadijah says C. All right. Got C question mark. Nicole says A. Okay. All right. So let's paint. You got to paint the picture like somebody who has a colostomy, right? What are they going to be looking like? What are they going to have? right? Paint. You'll always hear me say the term paint the picture. Okay. Heather, that's okay. Amanda, appreciate the follow. All right, here you go. Here we go. Here's our answer, y'all. Here's our answer. Here it is in 3, 2. RN is a type of license, at least in the United States, not a degree. Correct. And so the answer is C. Avoid foods that in the past cause flatus. Foods that bother a person preoperatively will continue to do so after a colostomy, right? And also, I know this has nothing to do with the question, but yes, I really wish that schools would change up the fact of saying like, hey, you know, it's RN to this. Like RN is a license. You can get your license as an associate degree nurse and as a bachelor's degree nurse. So I really would love for them to change that verbiage because it really confuses people. Hey, are you an RN or a BSN? I mean, I could have my BSN and not be an RN. All right. I can't believe I found this. I'm an RN student. Ma'am, I'm glad you're here. So since you like it here, I'm going to need for you to share and I'm going to need for you to follow me and be my friend. You know what I'm saying? All right, here we go. Is it K Vaughn? Yeah, there you go, girl. I appreciate you. All right, question 17. Nurse Ron begins to teach a male client how to perform colostomy irrigation. The nurse would evaluate that the instructions were understood when the client states, I should lie on my left side while instilling the irrigation solution. Keep the irrigating container less than 18 inches above the stoma. Instill a minimum of 1,200 mLs of irrigating solution to stimulate evacuation of the bowel. Or insert the irrigating catheter deep into the stoma if cramping occurs during the procedure. It's like, I'm an RN with an ADN. I went to law school and I deal with medical malpractice. Is it Clarissa? Like Clarissa explains it all. I know I'm probably like, you know, dating myself because some folks are like, what the fuck is that? So we got, so shout out to you for med legal. Shout out to you. I'm going to go with A. All right, cool. All right, Clarissa, I got you, girl. I got you. Med legal. I love it. I love it. I love it. All right, I'm going to give y'all 10 seconds. I'll give you 15 seconds. All right. Hey, if you guys are new here, make sure you guys like, share, and follow. Yes, definitely 90s, baby. I'm from Tech. Clarissa explains it all. Look what I'm talking about. Hey, shout out to all my late 80s, 90s babies. You know what I'm saying? Because that's how we do around here. Taking the NCLEX Friday. Is it Griselda? That's a pretty name, Griselda. Hey, on Thursday, I don't need for you to do nothing out here. All right, I need for you to chill and relax. All right, here we go. Here's our answer, y'all. Here's our answer before I get yelled at in 3, 2, 87, baby. All right, here we go. And the answer is B. Keep the irrigating container less than 18 inches above the stoma. This height permits the solution to flow slowly with little force. So the excessive, peristalsis is not immediately precipitated. Hey, I just want to let you know, I'm a nurse. I'm not a spelling bee champion. I don't say words right if you don't like it. I mean, you can 600 yourself. I'm just saying. It says, damn, makes me feel old. I'll be 43 next week. 87, baby. I won't be 43 next week. However, I will be 36 at the end of this month. So there we go. Shout out to y'all. But appreciate everybody being here. I love y'all. Make sure y'all like, share, follow. All right, here we go. Question number 18. 04. Lord of mercy. Jesus. All right, here we go. Patrick is in the oliguric phase of acute tubular necrosis and is experiencing fluid and electrolyte imbalances. The client is somewhat confused and complains of nausea and muscle weakness. As part of the prescribed therapy to correct this electrolyte imbalance, the nurse would expect to what? Administer K-Exolate, restrict foods high in protein, increase oral intake of cheese and milk, and administer large amounts of normal saline via IV. What do we got? Shout out to all 200 plus of y'all all up in here. All right. Make sure you guys like, share, follow. We're going over NCLEX questions. My name is Kevin. My credentials are I'm a registered nurse and I have my bachelor's degree working towards my master's degree in education. I don't know why I said it like that. That sounds like I'm an asshole, and I'm not that big of an asshole, y'all. I love y'all. Appreciate y'all being here. But I want to know who you are, where you're from, where you're at in your nursing journey. Let us know. Let's stir it up down in the comments. It says D, electrolyte. Do you have any tips for T's? The yellow Mometric book off of Amazon. Clearwater, Florida. I used to live in Jacksonville. I lived there for like 4 years. What is K-Exolate? Somebody let her know what K-Exolate is. I'm telling you right now, that's going to be one of those big medications you give on the floor as a nurse. I'm just saying. I may not have given it multiple times. All right, here we go. Here we go, y'all. Here is our answer. Here is our answer in 3, 2. And the answer is A. Administer K-Exolate. K-Exolate is a potassium exchange resin, permits sodium to be exchanged for potassium in the intestines, reducing the serum potassium levels. Physiological adaptation. So essentially, K-Exolate, it pulls potassium into the gut and it allows for you to excrete it through the gut. So K-Exolate is going to make you poops. Any tips to pass the NCLEX? Study for it. There's tons of tips I could give you. There's tons of tips I could give you right now. However, we'll go over those later on. If you're still here after the fact, we can go over those questions again. But biggest tips is definitely it's a mindset change. All right. Cameron. All right, here we go. I don't know why that is so tiny, but let me fix that. I'm going to read it to y'all. But it says, Mario has burns, injuries. No, let's go up. We'll go to here. Okay, obviously we're not going to go there. Yay. All right, here we go. So Mario, oh no. Hold on, y'all. Where did it go? I don't know what happened to it. There we go. Sorry, just kidding. All right, so Mario has a burn injury. After 48 hours, the physician orders for Mario 2 liters of IV fluids to be administered Q12 hours. The drop factor of the tube is 10 drops per ml. The nurse should set the flow to provide what? Is it 18 drops per minute, 28, 32, or 36? Austin says B. Okay. All right. Brittany, appreciate the follow. Thank you. Hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Cameron says B. Is it delay? Says D. Tracy says B. Joanna. Shout out to you, Joanna. When you get up in here, you ain't say nothing to me. Joanna says B. Griselda says B. Okay. Becca, appreciate the follow. What was I going to say? I forgot already. 10 seconds, y'all. 10 seconds. 15 seconds because I kind of messed up, so that's my bad. Oh no, not drip factor answer is E. Pray for Mario. No, you didn't. She's like, not dosage calculations. Oh my God. Can you explain how you got B? I don't know who you're talking to. You're talking to me. But this is why we're going to go over the rationale. Look at that. Austin says 2,000 over. Okay. All right. Okay. All right. Here we go. Here's our answer in 3, 2. And the answer is B, 28 drops per minute. This is the correct flow rate. Multiply the amount to be infused, which is 2,000 mLs, by the drop factor, which is 10, and divide the results by the amount of time in minutes. So 12 hours times 60. And there's your answer. Pharmacology, you will, I'm not going to say you will, but most people, when they take their NCLEX, they'll get, I think, anywhere from 1 to 2 dosage calculations to include something like this to try to know the drip factor. Okay. I had to get out my calculator. Hey, and by the way, you do get a calculator when you take your NCLEX. It's on the computer. All right. So it's kind of like any type of other ones that they have on there. All right. Here we go. Question number 20. Who says repeat? Ma'am, just like NCLEX, we don't go back. Okay. So here we go. Question number 20. Terrence suffers from burn injuries using the rule of nines, which has the largest percentage or percent of burns. Is it head and neck or face and neck, right upper arm and penis, or is it the right thigh and penis, or is it the upper trunk? Key says, I graduated April 24, but I'm in an accelerated BSN program. It's very fast. I was in an accelerated BSN program as well, and it is very fast. D, it's 18%. Okay. Shout out to you. Ma'am. Okay, we got D's all around. Hey, if you guys are new here, we're doing NCLEX questions. Make sure you smash the like button. Make sure you guys share and make sure you guys follow. Don't be greedy your whole life. All right. 10 seconds. We got D out here. Okay. Gabby, 2K3, appreciate the follow. Thank you. All right, y'all, here we go. Here's our answer. In 3, 2. And the answer is D, the upper trunk. The percentage designated for each burnt part of the body using the rule of 9. Head and neck, 9%. Right upper extremity, 9%. Left upper extremity, 9%. Anterior trunk, 18. Posterior trunk, 18. Right lower extremity, 18. Left lower extremity, 18. And the perineum area is 1%. percent. Physiological adaptation. All right. Third largest section on the exam. Hey, rule of nines is very important, especially anytime you get a burn patient. I used to work in a burn ICU, and the rule of nines and the rule of tens was a very, very big thing, as well as fluid resuscitation for burn patients. Always remember that, okay? All right, here we go. Hey, break time. We're doing NCLEX questions. Make sure you guys participate. Likes, follows, shares, gifts, all that good stuff. Give them to me. Don't troll my chat. You troll my chat, I'm going to ban you. I got these questions off nurselabs.com. 7-day NCLEX course in its pre-launch phase, $48. Check bio. And if you need tutoring or 101, hey, come book a phone call with me and let's see what's up. Link is in my bio. You'll see it in there. All right, here we go. All right, question number 21. What school you take your BSN from, and do you need to pass before you take your BSN? Landy, I'm not sure. I don't even understand how you even said that question, to be honest. But we can talk about that after the questions. Question 21, Herbert, a 45-year-old construction engineer is brought to the hospital unconscious after falling from a 2-story building. When assessing the client, the nurse would be most concerned if the assessment revealed what? Reactive pupils, a depressed fontanelle, bleeding from the ears, or an elevated temperature. All right? Hey, so we're talking about falls. Falls greater than 3 times your height, right? Or 15 feet or greater than 3 times your height, right? 2 stories. If this man's like not 10 feet, then it's an issue. Got bleeding, okay. Landy says A. Alicia says A. Appreciate the follow, guys. Bleeding from the ears, okay. All right. Appreciate the follow. Hey, if you're just now joining, we're doing NCLEX questions. Make sure you like, share, and you follow. I want to know who you are, where you're from, where you're at in your nursing journey. Let us know down in the comments, all right? All right, y'all, here we go. Here's our answer. We got C's all over the place. This is hard. All right, Madison, let's see. Reactive pupils is a good thing. Indeed, it is. Well, it's not a good thing. Unequal pupils. That's not a good thing, because that tells me what? All right, I'm going to give y'all the answer right now. Y'all answer that. Here we go. You're going for LPN. Shout out to you, Steph. Can I call you Steph? I'm going to call you Steph anyway. Here we go. Here's our answer in 3, 2, and the answer is C. Bleeding from the ears. The nurse needs to perform a thorough assessment that could indicate alterations of cerebral function, increased intracranial pressures, fractures, and bleeding. Bleeding from the ears occurs only with basal skull fractures that can easily contribute to increased intracranial pressure and brain herniation. Read that wrong. Hey, so RTFQ, man, I wish Avery was here, but she's not here. But RTFQ, hey, if you've been following me for a while, let them know down in the comments what RTFQ stands for. All right, let them know. Physiological adaptation, third largest section on NCLEX, okay? Here we go. Is it Simone? Thank you for the follow. Kayla, thank you for the follow. Here we go. Question number 21. RN 26 years, always be kind and non-judgmental. Facts. Wait, was I being judgmental? Did that happen? I don't know what happened. Anyways, here we go. Question number 22. Nurse Sherry is teaching male clients regarding his permanent artificial pacemaker. Which information given by the nurse shows her knowledge deficit about the artificial cardiac pacemaker? Okay, LPN and geriatric nursing. Shout out to you, Mama Heat. Is it A, take the pulse rate once a day in the morning upon waking up or upon awakening? Is it B, may be allowed to use electronic or electrical appliances? Is it C, have regular follow-up care? Or is it D, may encourage in contact sports? What do we got? In 7 months, I'll be a RN. That's what I'm talking about. Speak that into existence, Lexi. You will be a RN. You will be an LPN. For my person that was an MP, you are going to MP school, you will be an MP. You will be an MA. You will be a CNA. You will be what you want to be. Put it out into the universe, and it shall be so. L&D nurse, shout out to you, Griselda. Go out there and catch babies. You better than me, because I can't be in there with all that nonsense. I can't. If you know the story, I was in there one time, and there was one girl that was pregnant, and there was 5 dudes. Nobody knew who the daddy was. It was Maury in room 197. It was wild out there. Shout out to NICU nurses. Well, let's start from the beginning. OR here. Shout out to you. Hey, I work in the OR too, Alice. Shout out to you. All right, here we go, y'all. Here's our answer. Here is our answer in 3, 2, RN in February. Yes, that's what I'm talking about. So the answer is D, may encourage in contact sports. That is the incorrect thing to say, and you have a deficit in your knowledge baby nurse, boot nurse, whatever you want to call yourself, or just somebody who doesn't know anything about pacemakers, the client should be advised by the nurse to avoid contact sports. This will prevent trauma in the area of the pacemaker generator. Boom. And we don't want our pacemaker to go boom, but boom goes the dynamite with that answer. So 100%. All right. Health promotions and maintenance. All right. All right, here we go. Question number 23. The nurse is aware that the most relevant knowledge about oxygen administration to a male client with COPD is what? Is it A, oxygen at 1 to 2 liters per minute is given to maintain the hypoxic stimulus for breathing? Is it B, hypoxia stimulates the central chemoreceptors in the medulla that makes the client breathe? Is it C, oxygen is administered best using a non-rebreather mask? Or is it D, blood gases are monitored using a pulse oximeter? I'm a home health aide. This has been interesting. I got 2 right. Shout out to you. Sarah says C. Landy says A. Crystal, like champagne, says D. Mary says B. Shout out to all 240 y'all in here. Make sure you guys like, share, and follow, because, I'm lonely out here. I need friends. Okay. So, hey, I do these questions for y'all. Like I look forward to doing these, all throughout the week. Okay. So I look forward to doing these. Make sure you guys follow, like, share. The more people we get here, the better. Okay. 10 seconds. 10 seconds on this question. Appreciate Landy. I appreciate you being here. Who is it? Unladylike diva? No, you didn't. Ma'am, I'm glad you're here. Appreciate the follow. Appreciate the share. All right. Alicia says A. I need help. A. If you need help, go over. Hey, you can book a 15-minute call if you need help. D is wrong. Okay, here we go. Here's our answer, y'all. Here's our answer in 3, 2. We use Venturi masks. Yep. I like those masks. Those masks are pretty cool. So the answer is A. Oxygen at 1 to 2 liters per minute is given to maintain the hypoxic stimulus for breathing. COPD causes a chronic CO2 retention that renders the medulla insensitive to CO2 stimulation for breathing. The hypoxic stage of the client then becomes the stimulus for breathing. Giving the client oxygen in low concentrations will maintain the client's hypoxic drive. Respiratory drive, that's what I'm saying. Hypoxic drive is old dogma that has been disproven. That's right, it may have been disproven, but go ahead and tell the NCLEX that. All right, so even though you're saying it's disproven, on the exam it is not. Remember, on the exam it is perfect world, ladies and gentlemen. I don't know if your name is Eva or Eva, however you pronounce it, but remember, we got to go back to how perfect world is, right? It's perfect world. Although they've added the new gen stuff and they give you case studies for you to give you all the information that you need. You got to still realize that NCLEX hospital is perfect hospital. You know what I mean? We take the NCLEX and Utopia. That's right. Absolutely. Okay. So even though people come in here and they're just like, that's wrong, I'm going to be like, okay, well, according to the National Council, it is not wrong. That is what they want in there. And until they update that, you go off of what they say. You go off of what the book says so you can pass and get that license and get out here and get to work and stop playing games. All right, here we go. Question number 24. Tony has undergone a left thoracotomy and a partial pneumonectomy. Chest tubes are inserted and 1 bottle water-sealed drainage is instituted in the operating room. In the PACU, Tony is placed in Fowler's position on either his right side or on his back. The nurse is aware that this position does what? What does it do? Does it reduce incisional pain, facilitates ventilation to the left lung, equalizes pressure in the pleural space, or increases venous return? We got D's. Aaron, Aaron. Not even spelled that way. I don't even know why I said that. I'm sorry. Shauna, thank you for the follow. I forgot even what you said because I started laughing. Jennifer says D. Mama Heat says D. Marge. Okay. Jessica, thank you for the follow. All right. We got some B's and some C's out there. 15 seconds, y'all. Kat says B. Okay. C. And I'm guessing. That's cool. That's cool for you to guess. I'd rather you guess and pick an answer than not answer it at all and just try to skip it. All right. Landy says C. Okay. Shout out to all 400 plus of y'all. We're doing NCLEX questions. B. Haley. Okay. B. Guessing. Okay. All right. Here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is B. Facilitate ventilation to the left lung. Since only a partial pneumonectomy is done, there is a need to promote expansion of this remaining left lung by positioning the client on the opposite unoperated side. Okay. Physiological adaptation. Good lung down, baby. Good lung down. All right. So shout out to y'all. I appreciate the follows. Hey, I love y'all out here. Make sure you guys like, share, follow, smash that like button. Hey, we need like 10,000 likes, y'all. At least 10. I asked for 50, but apparently y'all got carpal tunnel going on out here. Okay. So here we go. All right, here we go. Question number 25. Christine is scheduled for a bronchoscopy. When teaching Christine what to expect afterwards, the nurse's highest priority of information would be what? Food and fluid will be withheld for at least 2 hours. Warm saline gargles will be done Q2 hours. Coughing and deep breathing exercises will be done every 2 hours. Or only ice chips and cold liquids will be allowed initially. So we got some C's, we got some A's. Okay. Haley, thank you for the follow. Appreciate you. Somebody asked how they needed help. Hey, if you need like one-on-one coaching or anything like that, you can book a 15-minute call with me. The link is in my bio. You can check that out. Need to check for that GAD reflex? I don't know. So they're talking about she's scheduled. So afterwards, what is the highest priority after somebody who is scheduled from a bronchoscopy? So what is it? First of all, let's ask the question, what is a bronchoscopy? Right? What's happening with that procedure? Right? How is that procedure done? Like, are we on local anesthesia, general anesthesia? Like, what are we looking for? Like, what are we looking for? Right? Okay. All right. I'm gonna give y'all 10 seconds. Grace, you ain't got to yell at me. All right. I see you. I see you. You said, hey, I see you out here, girl. I see you. So think about, those are the things. It's like when you think about the pathophysiology or what those procedures entail, you got to think about the whole. Like, okay, am I going up the backside or the front side? Am I going through the abdomen? What is the body going to look like? What is the body going to want? Right? Do I need pain meds? Is it under local? Is it under general? Is it under regional? Like those are the things that you got to think about. All right. But here's our answer. All right. Here's our answer in 3, 2, and the answer is A. Food and fluids will be withheld for at least 2 hours prior to a bronchoscopy. Prior to a bronchoscopy, the doctor sprays the back of the throat with anesthetics to minimize the gag reflex and thus facilitate the insertion of the bronchial scope. Giving the client food and drinks after the procedure without checking of the return of the gag reflex can cause the client to aspirate. The gag reflex usually returns after 2 hours. So then it becomes an airway issue. Right? It becomes an airway issue. That's what I'm saying. Hey, RTFQ. Hey, if you've been in my lives before, what does RTFQ stand for? What does it stand for? Our policy is 1 hour. Maria, it's not about your policy. It's about NCLEX policy. All right. Secure that airway. Right. However, even though your policy says 1 hour, you still know, like, numbers can be finicky, but it still knows that, hey, like, I can't do anything until gag reflex comes back. Read the effing question. That's right. That's what RTFQ stands for, y'all. Read the question. I'm not going to go back because in NCLEX, we don't go back, right? Appreciate the follows. Thank you for the shares. Smashing that like button. Let's go to the next question. Hey, real quick. Don't y'all go nowhere. NCLEX questions. That's what we're doing. Participate. Give me them likes. Give me all of them. Don't troll my chat. I got these questions from nurselabs.com. 7-day NCLEX course, pre-launch phase. You get it right now for $48. All right. And you get it forever. And if you need one-on-one coaching or you need tutoring, hey, book a call with me. That link is in my bio. All right. Boom. There we go. Question number 26. Nurse Tristan is caring for a male client with acute renal failure. Right? An AKI, acute kidney injury, right? The nurse should expect hypertonic glucose, insulin infusions, and sodium bicarbonate to be used to treat what? Is it hypernatremia, hypokalemia, hyperkalemia, or hypercalcemia? Delaney says C. Delaney, you ain't got to scream at me, girl. I see your answer out here. I appreciate you. Unique says C. Okay. Cristal, like champagne, says C. Okay. Jess says C. Wisdom says C. Shout out to y'all. Okay. Is it Joe Henderson says A. A Paige says C because of the electrolyte shift. Okay. Hey, because if my kidneys ain't doing what they're supposed to be doing, that means every other electrolyte is about to act a fool out here. Okay. Insulin helps potassium get into the cells and out of the blood. Look at you, girl. No more. Amen. All right, y'all. I'm gonna give y'all 10 more seconds. The kidneys are not able to rid the body of potassium. Look at you, Camille. Girl, you're so smart. Look at that. Look at y'all. I'm so proud of y'all. Do you only do NCLEX course? Anything for NP students? Steph, not yet. That's in the future. That's coming. That's coming, but not yet. Are there any tutors in the chat? We don't really have any tutors in the chat, but I do tutoring, so you can check that out. Look, my link is in my bio. Here we go. Here we go. Here's our answer. Here's our answer in 3, 2, and the answer is C. I know that is tiny. I know that is tiny. So I'm going to read it. Hyperkalemia is a common complication of acute renal failure. It's life-threatening if immediate action isn't taken to reverse it. The administration of glucose and regular insulin with sodium bicarbonate, if necessary, can temporarily prevent cardiac arrest by moving potassium into the cells and temporarily reducing serum potassium levels. All right, cool. So what is the way to get it out of the body? Move potassium into the cells. So it's necessary, can temporarily move potassium into the cells, right? And temporarily reduce the levels. So how do we get it out of the body? Snap the picture. Hey, there you go. So how do you get it out of the body? Got to get those kidneys right, though. Dialysis, right? Dialysis as well. Stool is another one, right? But dialysis is because kidneys aren't working at this point. Because how are you going to filtrate the rest of it? Pee, right? That's how you get rid of it. The ways that you get rid of it: diuretics by pushing it out through urine, K-exhalate pushing it out through the gut, and dialysis and temporary port. There you go. K-exhalate, because K exits late, baby. All right, here we go. Question 27. Miss X, maybe she's like the spouse of what used to be Twitter, but whatever. But Miss X has just been diagnosed with cauda I'm not even going to attempt to say that, but genital warts. What information is appropriate to tell this client? This condition puts her at high risk for, high risk for cervical cancer. Therefore, she should have a pap smear annually. The most common treatment is Flagyl, which should eradicate the problem within 7 to 10 days. The potential for transmission to her sexual partner will be eliminated if condoms are used every time they have sexual intercourse. Or D, the human papillomavirus, which causes genital warts, can't be transmitted during oral sex. Man, that is crooked. I don't know what's going on over here. All right, here we go. Gotta be A. Okay. Shout out to all 160 plus of y'all. Man, we dropped. People don't like me no more. But hey, if you're new here, we're doing NCLEX questions. Make sure you guys like, share, smash that like button, like and share and follow. Camille says easily A. Okay. As a Michaela says A. Okay. All right. I want to know who you are, where you're from, where you're at in your nursing journey. I'm new here. You're doing great. Delaney, I appreciate you. I do these all the time. And hey, I'm just letting you know, if I don't know how to read stuff, hey, do I look like a child that is going to be like in a spelling bee? I think not. I'm a whole nurse and I don't read well, but whatever, So do I do lives every day? No, I do them Monday, Wednesday, Friday at 5:30 Central Standard Time. All right, here we go. Here's our answer, y'all. Here's our answer in 3, 2. Somebody said they were retired, and I'm sorry, I couldn't read the whole thing. I've come to your lives before, taking the NCLEX soon. Oh, yeah. Michaela, I know. I see you look familiar. I see familiar names. But the answer is A. This condition puts her at high risk for cervical cancer. Therefore, she needs to have a pap smear annually. Women with genital warts are at risk for cancer of the cervix and vulva. Yearly pap smears are very important for early detection because genital warts is a virus that there is no permanent cure. I am just starting on ATI. Okay. I'm from Utah and I'm not doing any nursing or medical degree. Okay, cool. You're not doing that, but I appreciate you being here. I stopped studying, but back in it now, and I know I'm going to pass that B. That's right. You're going to pass it. You're going to pass it. You want to know why? Because you put it out into the universe and it shall be so. All right. Physiological adaptation. All right. Remember that. That's a big part of the section on NCLEX. All right. Here we go. Question number 28. Is it Sukdeep? I don't even know if I said that right. Let me know if I said that right. I pride myself in trying to pronounce people's names. All right. So here we go. Is it Marites? Was recently diagnosed with a genital urinary problem and is being examined in the emergency department. Oh, I said it right? Man, I'm proud of myself. Thank you for letting me know that. When palpating her kidneys, the nurse should keep which anatomical fact in mind? The left kidney usually is slightly higher than the right one. The kidneys are situated just above the adrenal glands. The average kidney is approximately 5 centimeters long and 2 to 3 centimeters and 3/4 inch. Whoa, hold on. Oh, wide. Okay, there we go. And the kidneys lie between the 10th and 12th thoracic vertebrae. Everybody's screaming A. Man, I'm really proud of myself. I said this as soup deep. Man, I said that right. All right, cool. All right, what y'all got for me? What y'all got? LPN bridging. I saw a bunch of y'all say LPN, so shout out to y'all. I love my LPNs, every single one of y'all. Hey, the nursing field needs LPNs out here. The nursing field needs every aspect of medical professionals out here. I don't care what level you're at. CNA, MA, tech, LPN, RN. I'm telling you right now, you can really make moves out here if you know what you're doing. All right. We got A's out here. I'm gonna give y'all 10 more seconds. Shout out to all 150 of y'all that are up in here. Make sure you guys smash that like button, share, and you guys follow me. All right. All right, here we go. Sarah says where? Where what? What you mean? On the way to RN. Shout out to you. We already know. We know what the deal is. Here we go. Our answer in 3, 2. And the answer is A. The left kidney usually is slightly higher than the right kidney. The left kidney is usually slightly higher than the right one. An adrenal gland lies atop each kidney. I'm actually enjoying this live. What's the schedule? The schedule is on my bio for anybody that ever wants to know when I'm not on here, but Monday, Wednesday, Friday, 5:30 Central Standard Time. All right, here we go. Here we go. Question number 29. Justani with chronic renal failure is admitted to the urology unit. The nurse is aware that the diagnostic test is consistent with CRF if the result is what? Increased pH and decreased hydrogen ions? Is it increased serum levels of potassium, magnesium, and calcium? Is the BUN, the blood urea nitrogen, 100 milligrams per deciliter, and serum creatinine is 6.5 milligrams per deciliter? Or is it D, uric acid analysis is 3.5 milligrams per deciliter, and phenylsulfa PSP, like the handheld device, excretion at 75%. Said definitely it's C. Okay, who said something about that? Monday, Wednesday, Friday, Texas time. Joanna, you know what the deal is, girl. Hey, I appreciate you advocating out here for me. You know what's up. So, hey, if you guys are new here, make sure you guys like, share, and follow. All right, smash that like button. Make sure you guys participate. Thank you, Soup Deep. I appreciate you. All right. All right. Here's our answer. Our answer's coming up. Just got a number 1 badge. Okay. Shout out to you, girl. Thank you. BUN is too high. Okay. All right. Appreciate the follow. All right. Here we go, y'all. Here we go. Hey, remember, hey, if you become a nurse or if you're in nursing school, don't you ever go to a nurse or any instructor and say bun. They're going to look at you like you lost your damn mind. All right. Here we go. Answer is, somebody said most definitely C, and it is most definitely C. BUN, or blood urea nitrogen, 100 milligrams per deciliter, and serum creatinine is at 6.5. Just the serum creatinine alone, even if you didn't know what the BUN was, that is extremely out of range, right? So remember, is like, what is it? 8 to 25, 8 to 25. Anything that's out of that range is extremely high or low for BUN. And serum creatinine, we already know that it can't go above, or it says 8 to 23, but on NCLEX, you won't see it be like 23, 24, 25. You'll see high numbers like that. That's what you'll see. So you can't say bun. Don't say bun. Don't do that. They're going to look at you like, a bun what? Like, it's not bun. It's BUN. Yeah, it's taking NCLEX in 2 weeks for PN. Shout out to you, Kels. Shout out to you. All right, so the normal BUN range is 8 to 23. The norm serum creatinine is 0.7 to 1.5. The test results in option C are abnormally elevated, reflecting CRF, and the kidneys decreased ability to remove non-protein nitrogen waste from the blood. All right, reduction in risk potential. That is what we're looking for. Guys, enjoy the rest of the live. I'm going to go do my ATI and do go. All right, shout out to you, ma'am. I appreciate you being here. All right, here we go. Question number 30. All right. Katrina has an abnormal result on a PAP test. After admitting that she read her chart while the nurse was out of the room, Katrina asked what dysplasia means. Which definition should the nurse provide? Persistence of complete undifferentiated tumor cells that don't resemble cells of the tissues of their origin, increase in the number of normal cells in a normal arrangement in a tissue or an organ, replacement of one type of fully differentiated cell by another in tissues where the second type normally isn't found, or is it D, alteration in the size, shape, and organization of differentiated cells? I see people screaming D up in here. Cameron says C. Okay. Hey, if you guys are new here, I want to know who you are, where you're from. Make sure you like, share, and follow. I heard someone say that the labs show abnormal on NCLEX. Is that true? No. So what you'll see on NCLEX is they will give you what the normal ranges are. So I'll give you potassium 3.5 to 5.0 or 3.5 to 5.3 or whatever that they'll say, right? But you need to know. They'll say, hey, the potassium is at 6. We know that's abnormal, but you need to know what could happen to your patient with it being like that. Is it easy? It depends. It depends on you. I personally think that the NCLEX is easier. I can actually give you numbers to compare to how it was from the old generation to the new generation. All right. And we'll talk about that when I do this AMA. All right. But here we go. Here's our answer. In 3, 2. And the answer is D. Alterations in size, shape, and organization of differentiated cells. Dysplasia refers to that exact thing that I just said. That is the exact definition for it. Okay. Physiological adaptation, third largest section on NCLEX. Okay. Brittany said, hi, I'm new here. I'm currently in a MSN program. Shout out to you, Brittany. What are you doing in that MSN program? I'm assuming you did like the direct, the direct entry master's program. We need critical thinking. Yes, that's 100% is what you do need. Critical thinking, clinical judgment on NCLEX. Yeah, I figured that's what you were doing, Brittany. But so my question is, what are you getting your master's in? All right. Hey, and that, ladies and gentlemen, that is a wrap on the NCLEX questions for today. Now we're about to do the AMA, or essentially Ask Me Anything. I appreciate you guys hanging out. I really do love doing these. I really do appreciate you guys being here. Nobody got banned. You guys know where to find these questions. Also, if you guys want to see, I did a summit, a nursing school summit. So you guys can go over there and check that out. That video is actually going to be up on my YouTube come soon. Make sure you guys check out the 7-day NCLEX course and also check out thebootnurse.com. So with that being said, I'm going to turn this camera around so you guys can see my, I guess, glorious face that people just love to see. And I'm just going to say this right now. People are going to be like, oh, I thought you were Jason Derulo. Chill out. You saying? Pickle Rick, baby. All right. So, hey, how y'all doing? My name's Kevin. Been a nurse for 3.5 years. Worked in the OR, worked in ICU, all that good jazz. So what questions do you guys have? I want to know who you are, where you're from, where you're at in your nursing journey. I'm going to hang out for probably about another maybe like half hour, 15 minutes. You know what I'm saying? Thanks. I learn a lot every time. See you Friday. See you Friday, Camille. I see you Friday. So yeah. Essentially like what y'all got for me. What unit did you start in? I started working in a burn ICU. And I worked there for 6 months while I was active duty in the Navy. And that was probably one of the best places I think I ever worked because I learned so much while I was there. And I had really great nurses that were around me when I was there. I'm in my 3rd year nursing assistant. In high school, currently in phlebotomy courses. Shout out to you. I'm a CNA. Okay. Working towards my BSN or doing your BSN. I got you. 19. Nice to meet you. What was your biggest motivation in nursing school? My biggest motivation in nursing school was, at that point, it was becoming a commissioned officer and wanting to really expand my knowledge and expand my responsibility. That was the biggest thing. And then, of course, the road to retirement at that point. But now that's not necessarily what my thought process is. Now my motivation is teaching you and teaching other people and motivating other people. So that's just me. Scared to take the NCLEX. Soup deep. Why? Why are you scared to take it? Brianna says, I am from Baton Rouge, Louisiana. I will graduate. So you graduate. It's right around the corner. And LPN, shout out to you. What did you score on the NCLEX? Do you remember? There was no score. It was fail, and then pass. That's what it was. First semester nursing school from New Orleans. Shout out to you. I'm thinking about starting in cardiac when I head. Hey, if that's where you want to go straight there. Love this. Love See You Friday. Appreciate you, Tracy. She's already gone. And also Payne. Okay, what it says, graduate. Graduated my ADN program, but never took the NCLEX, still paying the loans. Hey, I'm telling you right now, Barbie, and I ain't trying to be pink with you, and I ain't trying to be all, all start, Margot Robbie'd up. But if you get that, if you pass your exam, then you can go out here and you can, get your experience, then get out there and start traveling and start getting some of this other money that nursing can get you, and you can pay those loans off faster instead of you not paying, unless you have a good paying job and you like where you're at. Jen said, it's me again from last week, Jennifer from Massachusetts, nurse for 37 years. Phew, ma'am, I remember. Yeah. And I know we were talking about PhD and all this. I remember. You talk about taking the NCLEX multiple times. What changed from failing the first time, to when I passed? Honestly, it was a mindset. I was lazy. I wasn't accountable. And I had a very huge content deficit. I was just like everybody else. I was scared to take it. I thought I knew, but I didn't. I didn't have any structure. And once I figured all those things out and I put myself on a schedule, I structured it out. I realized where my areas that I was having a hard time in. That's what really changed up things for me. And then when I took the NCLEX, I got it in 60 questions. Appreciate the heart from Cristal with champagne. Thank you. Once I did that, I went in there and I took it at 60 questions. Y'all can go check those videos out there on my YouTube as well. So, did you think that the ICU was a good place to start? I'm interested in med-surg or ICU, but unsure. Delaney, I'm gonna tell you right now, go where you want. Most people will tell you to go to med-surg first. I say go to where you want. Do not pass go. Do not collect $200. Go straight to where you want to go. However, med-surg is good. Med-surg is good, ICU is very good too, but it's a lot more fast paced. So you got to pick up on things really fast. So deep I failed last time. I'm just worried. So here's the thing: you failing. I'm going to tell y'all right now, to all 70 of y'all that are in here hanging out, if you failed, it's your fault. If you failed, it's your fault. So now you're telling me that you failed. It's like coming to me with a problem and not a solution. Tell me why you failed. Did you look over your breakdown? Did you reach out for help? Are you not understanding something? What deficit do you have? Like, those are the things that you really have to ask yourself. Once you figure those things out for yourself, you'll be on a point from A to B. To really ruling and conquering this exam. I promise you, because I had the same thought process. I thought I was a failure. I thought I wasn't worthy. And then I get out here and I'll be like, I can't believe I made this a lot harder than I needed it to be. All right. I graduated nursing school from Minnesota. I failed my NCLEX the first try. Okay. Same thing will go to you, or the same question would go to you. What would be good advice for tackling case studies for the NCLEX? I'm from Tennessee. Practice. And then studying content with practicing those questions. I'm in construction and a labor. Oh, okay. And work with IPP in Utah. Okay. I'm Kim, finishing up my RN in February, preparing for the NGN. If you could give me one trick. So here's the thing. There is no trick. There are no tricks to this exam. I promise you, there are no tricks at all. It is literally about you studying, putting in the work, retaining and acquiring the knowledge. I promise you, there's no trick to this exam. And anybody that tells you like, hey, I'm going to teach you, or here's the trick, like, you got to know, like, you got it. Like, content is there for a reason. The questions are there for a reason. You need to understand the content so you can apply it to questions. That's exactly what it is. And you have to practice it. You have to make it. It's just like when you pick up anything, you have to create a habit in order for it to stick. I'm studying for ATI. What should we use to study material? I say the Mometrics book, the yellow Mometrics book you can get off Amazon. Just type it in, ATI Mometrics. You'll see that yellow book come up. What are your thoughts on male labor and delivery nurses? It's either that or the ER for me. Man, sir, for me, I'm not doing labor and delivery. You go wherever you want. I can't do labor and delivery because you just know when it's not you, and it wasn't for me. Congrats to all of you in your studies, right? Just failed last time, and I'm just worried. So deep, you ain't got to be worried. What you need to do is you need to prepare. You know what I'm saying? If you stay ready, you ain't never got to get ready. I realized I hated it. Just took me the entire program to realize it. Oh, so you realize that you hated being a nurse I see what you're saying. I see what you're saying, Barbie. That makes more sense. Griselda says, I work part-time in school and a mom of two and going to pass the NCLEX next Friday. My favorite number is 13. Griselda, that's what I'm talking about. We speak things into existence. Neurodivergent, ADN nurse, single parent, send good vibes. Vibes always getting sent. My anxiety is skyrocketing. Why? Why? So here's the thing. If you let something, here's the thing. You can't let things control. You have to have control over that. And hell, even if you need to get medication, and this isn't me giving anybody medical advice, but if you have anxiety that is out of control, you might want to seek some additional help for that. That's just being completely real. I figured out things and now I'm focusing to pass this time. That's what I'm talking about. Soup deep. That's what I like to see. So I feel like, how many hours do you recommend studying a day? I don't know. How many hours can you dedicate? It all just depends. We all have 24 hours in a day. All of us. We all have 24 hours in a day. However, you decide you need to divvy up your time is how you need to do it. It's just like when you're trying to create a budget. What are the things that you need to get rid of that are nonsense? Like you have 1,000 subscriptions that is costing you $400 a month, but you realize that you only look at one or two of them. Get rid of the rest of them. So just like with your time, get rid of all the things that are unimportant and dedicate that time to you studying. Right? I use Kaplan NCLEX exam prep. I found it super helpful. So Naomi, I used that. I used Kaplan and I used Mark Klimic when I studied. Though, and all these other reviews out here really made me see why I wanted to create a review for myself and for other people, which is why I created one. So Dungeon says no tricks, facts. Now I understand it's all about understanding the concepts about diseases. It's not necessarily all about understanding the concepts. Yes, you need to understand the concept, but you need to be able to apply the concepts to what they are asking using your critical thinking and clinical judgment. Like, what do you need to do next? Or what is the most important thing that you need to do in order to maintain this patient's survival? What about your time management? What about your decision-making skills? Can you delegate? And this is mostly, I'm talking about RNs, right? So Michaela says, I'm putting in the work, hours a day studying, but I'm afraid of not efficiently studying. Okay. If you're afraid that you're not officially studying, the best way to show that you're not officially studying is to do questions and answers, because your grades, your results are going to reflect that. Kaya says, doctor gave me propranolol for my anxiety. And do you feel like it's working? It says brain is coming back, but the anxiety is going up too. And just like I said, those are things that you would want to discuss with with a provider, because maybe like I said, I'm not giving medical advice, but you might want to seek something to help you with that. Because if you allow it to take over, you'll never get anything accomplished. Not even just this exam. Okay. Yeah, it has. Hopefully it helps when I go take the test in 2 weeks. Let's hope it helps. I hope it does help you. Facts. It says, I'm so excited to find you, mom of 5, 38, starting nursing school. Stay-at-home mom for 14 years. Now look at you. Now you're about to get out here and get this RN or get this LPN or whichever one that you're doing. It says, but it's okay. I'm excited. I know what the problem was and I can fix it. That's right. Because I'm going to tell everybody in here, all 44 of y'all that are in here just listening to me run my mouth talking about nursing and NCLEX stuff, is that it's your fault. Everything is your fault. But the thing is, like, how are you going to fix it? How are you going to fix it? Right? And even if it's not your fault, and what are you going to do to fix it? There are things that are out of your control. How can you fix these things? If you don't understand content, how are you going to understand content? If you don't know how to answer NCLEX style questions, how are you going to be able to understand NCLEX style questions? With practice. And if practice isn't working, do you need more help? Right? Do you need a tutor? Right? Or is the review not working for you? Because not every review is going to work for you. Not every review is going to work for you. Griselda says you should be a motivational speaker. Hey, look, I actually was talking to a few of my friends about that today, and I love public speaking. I love it. So that's actually going to be one of the things. I would love to go into a school of people, a school of nurses specifically, the people that are in my realm, and I want to talk to them. And I want to let you know, like, hey, don't be scared of that exam. Remember, y'all, I failed the exam 3 times, and I am here to tell you that degree that's sitting right there has been in the same spot in the same damn frame for the last 3.5 years collecting dust and ain't fucking moved. It ain't moved. All right. Once again, I had a problem. I had to find out to fix it. But you ever heard the term closed mouths don't get fed? If you don't open up your mouth to try to figure out how to fix your problem, you're going to stay in the same position. And then you're going to blame everybody else for the fact that you didn't get to where you wanted to be. That's facts. Just being completely honest. All right. Case, I'm so glad I found you 100%. I'm glad that you're here. I'm glad you stayed. Just listen to me talk. So Michaela says, okay, but the amount of reviews out there, it's overwhelming. It can be overwhelming. So here's the thing. You could go on Amazon and buy a product and it just be terrible. But is that going to stop you from going on Amazon to buy a product just because that one was terrible? Right? No, you're not going to stop doing that because you're going to go out there and you're still going to shop Amazon. You are. I guarantee it. You will. Right? I kid you not, for the fact of me failing the exam 3 times, so I had to do applications, other reviews, Pearson VUE, I spent almost $3,000. Almost $3,000. I spent $3,000, so you don't have to. You can go to my website right now where I have my 7-day NCLEX course, and you look down at the bottom, it says, I spent $3,000, so you don't have to, which is why I created this review. However, some reviews are not going to be good for you. You have to be able to understand that, you as a consumer. But guess what? People are going to get bad reviews. You're still going to go to that restaurant. People are going to get bad reviews. You're still going to buy that product. People are going to get bad reviews. You're still going to do it. You're still going to do it. You ain't got no problem going to Victoria's Secret, even though they have bad practices and shit. You ain't got no problem going to, if you're a gamer, you ain't got no problem going to GameStop. You ain't got no problem doing this. You ain't got no problem doing that. So sometimes you have to invest money in areas to figure out what will work for you. I invested $3,000 towards multiple different things until I found the one that worked for me. Or the two that worked. Oh, yeah, the two that worked for me, which was Kaplan and Mark Clement. But those two, if I wouldn't have failed, I would not be here talking to you. You want to know why? Because most people, when they pass, they're selfish. They go away. They go to work. They take, and they don't give. Right? But here's the one thing I'm going to tell everybody, all 100 of y'all, all 38 of y'all. When y'all pass your exam, you better pay it forward. You better pay it forward. And by paying it forward, I mean, you better not be an asshole when you're out there working on the floor. You better remember that you used to be in this position and be a preceptor and teach. Stop taking and give more, because that's what's going to make the community better. Did you listen to Mark Clemick for all your attempts? I listened to Mark Clemick for all of my attempts. I did, but I didn't really hear and listen. It didn't really absorb until my last time I studied. And you say you hate Victoria's Secret. Look, you know what I'm saying? Yeah, agree. That's what I'm trying to say. Melanie, ma'am, how are you? How are you? Hey, questions are already done. You already know what we're doing. We're doing this Ask Me Anything type deal. So, but why though? What the change? What do you mean? Love you, got to go. Appreciate you, Joanna. Michaela, what do you mean? I need for you to elaborate. Hey, if you guys are new here, we're doing why Mark Clemick, what changed? So I had a nurse who was an ICU nurse. He's still it's Melanie. Yeah. What did I say? Mallory. I'm sorry. My bad. I usually say Mallory. My bad. See, MJL, I know who you are. That's what I'm saying. You know what I'm saying? But my bad. I appreciate you correcting me, humbling me. You know, sometimes you got to get checked out here. And I got checked, and it's all good out here. So watch me say it again like on Friday. But what changed is that I had a nurse, an ICU nurse, who checked me. That's what happened. I had an ICU nurse who checked me. He looked me dead in my face and he's like, you failed the exam. Well, he's like, wait a minute, you've passed school. You did this and you did what? His exact words. And he was just like, obviously you aren't doing some shit right. That's exactly what he said to me. And he was just like, he pretty much took me under his wing and he mentored me. That's what he did. I appreciate you. Thank you. Is it Fina Love? Fina. Hopefully I said that right. Fina, thank you. Whoever, I think that was you who gave that to me. Somebody gave that to me. No, it was Farah. I'm sorry. Thank you, Farah. Thank you for the crown. I appreciate it. So I had a mentor, and it just so happened. He and I ran together. We ran into each other. I asked him a question and he looked at me dead in my face. And at that point, he took me under his wing and he told me what I was doing wrong. And that's exactly what happened. And once I sat down and I talked with him for an hour, every week or every so often, he was like, hey, so what are we doing? And I'm just like, this is what we're doing. This is what we're doing. This is what we're doing. I gave him updates and he's like, all right, let me know. And then next thing you know, after some time, COVID happened. And then I sat for my exam and then I passed. That's exactly what happened. So that's what changed. It was my mindset. It was the fact of me being lazy. I wasn't being accountable. I wasn't studying effectively. I was sitting in my living room with the TV on mute, with me sitting on my laptop with my phone. I wasn't even on TikTok then. I was on Instagram, Instagramming. And then next thing you know, I'm only getting through like 4 questions within an hour. And then, or sometimes I fell asleep on the damn couch taking a nap. So of course I'm not going to fucking pass that exam. Of course I'm not going to pass it. And the thing about it is, like, most people are like that. Or people overstudy. You got to remember that your brain is a muscle and you have to give it time to relax. You have to. You're not going to get anywhere if you don't. Okay. But, Michaela, that is what happened. And then once that happened and I was hyper focused on my one goal, which was to pass this exam, I passed it. You need to seek out nursing schools that have seniors to help get information to them. Oh, ma'am, sir or ma'am. I do that already, actually. I'm actually doing that tomorrow, where I'm going to be talking to some LPN students, actually. Essentially, talking about my course, but then also letting them know what nursing is really about out here. And I'm telling you right now, it ain't about being at bedside. It ain't about, unless you want to work at bedside for your whole career, that ain't it. There are so many things that you can do out here. It's ridiculous. So on that note, I'm going to watch my comfort show and do flashcards. Good night, everyone. All right, cool. Appreciate you being here. But yeah, so I do that already. And like I said, I'm actually doing that tomorrow to go talk to, I think, about 10 or 12 students that are graduating, I believe, in December, and they're LPN students. So, and I'm super excited because I love talking to them, because I wish I would have had somebody that was like that when I was in school. But, that's not what happened. So, but anyways, oh, that's what Jennifer, got you. Okay. It's me, Jennifer. It's me, Jessica. Don't you recognize me? All right, I'm done. No more of that. But hey, so shout out to 34 y'all that are up in here. What other question you guys got? I'm gonna hang out for probably about another 10 minutes. So I just don't want to be sitting here talking to myself and then, me not giving you guys some type of value. All right. But then that was another reason why I started coaching. I've been tutoring and coaching for NCLEX since the day I got my license. I felt like an NCLEX expert at that point. So now I teach people what worked for me, but it all is a mindset. Like, you got to shift. You have to shift. And if you don't, then maybe that doesn't work for you, which is another reason why I did my tutoring or why I do my tutoring. Right. Were you working while you were in nursing school? Yes, I was active duty in the Navy when I was in nursing school. Not only was I active duty, but I was actually a surgical tech instructor. I was actually a surgical tech instructor while I was in nursing school. So you are telling your testimony. That's right. I do that every time. I do it every single time. When people come out here and they start asking me, questions about stuff, I'm just like, cool. This is what it's about. I ain't got no problem. I ain't got nothing to lie to y'all about when it comes to this. Nothing whatsoever. I gain nothing from it. I just want to let y'all know what's up out here. So, but yes, to Kristen, I was working full time. Thank you for your service. You're so inspirational. I appreciate you being here. I appreciate your support, especially with a lot of things that are going. I'm actually still in the reserves right now. I've been in the Navy for 16 years. But, in the break of things that are happening, sometimes, your boy might want to exit stage left. So did your mentor have experience with NCLEX RN? My mentor was an ICU nurse. He was a 15-year ICU nurse. And he, at that point, he had just got finished with, not finished, but he was in CRNA school. And then he had some personal issues come up. And then he had to separate from CRNA school. But he was very much experienced at that, because he took it, because he was an ICU nurse for 15 years. So yeah, he was most definitely, and he took the NCLEX. He had been a nurse for like 15. At that point, it was 15 years. So I'm not going to say he did it on paper, but there's some people that are here that did it on paper, but they changed it from paper to computer, I believe, like in 94. I think somebody can fact check me on that. So, but yeah. Are you interested in teaching classes, or do you? So I actually have taught classes for nursing. I've actually applied for nursing adjunct positions. So and now it's next gen. So here's the thing, Michaela, is that the next gen NCLEX is no different from the old NCLEX. The same question types are there. 60 to 70% of your exam is going to be multiple choice, and it's going to be select all that apply. Now, the other 30%, 30, 40-ish percent is just the way that the questions are asked. It's just how it's delivered to you. 88 was when it changed from paper to computer. Okay, thank you. I appreciate you fact checking me. Thank you. I was born in 87, if anybody wants to know, but whatever. So, but yeah, so to answer your question, the old questions they're not gone. They're there. The case studies are what are being added. But even when they add the case study, they give you as much information as they possibly can. Really, Heather? Really? Really? I know you're not talking. I know you're not talking. All right. I'm about to roast you. You already know what's about to happen. Anyways, but with the new gen, like I said, it's all about how the questions delivered to you. You'll still get extended multiple choice. You'll still get extended select all that apply. You'll get the closed questions where they have the drop down where you pick. You get the matrix ones. You get the bow tie. Yeah, it's at least like 40%. You know what I'm saying? But like I said, you'll still get multiple choice questions inside of the case studies. You'll get them inside. Heather, I miss you too. I was actually talking about you the other day. As a matter of fact, I was talking about you today, as a matter of fact. And it was all, yes, and it was what you thought it was. It's all bad. It's all bad. So, but yeah, so it's at least like 30 to 40%, right? But like I said, and it's partial credit. So who is it? Rosanna, thank you for the follow. Thank you for the flowers. Appreciate you. Love that for me. Nah. We don't love that for you. We don't love that for you. Okay. But, like I said, it's all about how the questions are delivered. Like with one case study, I can give you 6 question types, and 3 of those 4 questions can still be multiple choice. You know what I mean? So it's like the multiple choice aspect of the question is still there, but you get more information because they give you the health and history. They give you the vitals. They give you the progress reports, like what it looks like at 07, what it looks like at 1000, so on and so forth. That's what it looks like. Jeremiah says, did you go through a fundamentals program or concepts based program? Here we do concept based. Ours, I think, was fundamental based. Are you talking about like for nursing school, Jeremiah? If you're talking about for nursing school, then it was fundamentals that I could remember. Yeah, it was fundamentals, I believe. But you got to think it's just like all nursing schools are based off of evidence-based practice. So either way, it doesn't really matter as long as the information is being passed in the correct way. It says paper when I failed the first time, second time I took it on the computer where the computer went blank. That's the worst. And you know what's crazy? What happens if your computer goes blank? You got to start all over. They don't start you over. They don't do nothing. If your computer goes blank or if your power goes out, that was my worst fear when I was taking the NCLEX, is that the power was going to go out or my test was going to turn off before anything. It's terrible. It's terrible. But appreciate you guys' questions. If you guys are new here, my name is Kevin. Check me out on YouTube, on Instagram. If you guys want to, if anybody needs like one-on-one coaching, I do a free 15-minute consultation call. You'll also do an intake. That way I know a little bit about you. That way we don't waste 15 minutes sitting there just talking about nothing. As well as, to see if coaching is right for you. You know what I'm saying? So like I said, I've been doing coaching for 3 years. Everybody that I've coached has passed their exam. So if that's something that you need, like one-on-one tutoring, you go check that out and book you a time and, come holler at your boy. And I've had people come up to me, they were just like, you're a scam. And I'm just like, sir or ma'am, I am here, right here. You can ask me questions. You know what I'm saying? I'm not like those people that send those messages and they spam your Instagram or your chats or whatever. And they're saying, I talked to Dr. Williams and they were a lifesaver. Hit me up on WhatsApp. Nope. No, I will never hit you up on WhatsApp. You know where to find me on all my social medias. As a matter of fact, I'm actually about to verify a bunch of my social media, so you know it's me. And I don't have any problem replying to you. So, like I said, if that is what you need for yourself, go over there and check that out. So, but anyways, what else you guys got? If you guys don't have any other questions or any comments or anything like that, then, your boy can go and check out his homemade KFC fucking KFC bowl, whatever. Did you ever work in the NICU? I did not, Kristen. I'm sorry. I did not work in the NICU. I did do my NICU rotation and I liked it, but then I realized that a lot of the babies that were in the NICU at that point, Where I was, it was just like they were there because of like drug addicted parents, and you know, like really just really terrible parents and people that should never be parents. And you know, little people kind of scare me. They decompensate so fast. I learned a lot while I was there, but I never worked in the NICU. So I give a lot of credit to my NICU nurses that work out there for sure. When will you do your next live video? How often do you do them, Valerie? You can check that out. The link is in my bio. I'm sorry, you can check that out. I posted in my bio, but I do my lives Monday, Wednesday, Fridays at 5:30 Central Standard Time. Okay. Kristen said, my daughter was in the NICU, so that's what I want to do. She was born early at 33 weeks. Okay. You're welcome, Valerie. No problem. Hey, so that's where your heart lies. You know what I'm saying? Is because you understand what it's like for, you know, to be in that. You want to be on the other side to help other people that are going through the same experiences that you went through. And that's understandable. That's why a lot of nurses, people that become nurses, go those routes because of their personal experiences that they had, you know, in those specific areas. I wanted to be a CRNA for the longest time is because I had a really good CRNA take care of me, and a CRNA that I worked with when I was an EMT and then when I became a surge tech and stuff like that. And I really looked up to them and I loved them. And I was like, man, I want to go into that position. But then, you know, I had a whole bunch of other things in life that happened. And I was like, nah, I don't want to do that. That's not where my heart was at. My heart is here teaching and conveying, you know, information to nursing, pre-nursing students, nurse grads, you know, brand new nurses, or even nurses that have been nurses for 40 years. Just because you've been a nurse for 40 years don't mean you fucking know everything about the world. Like, let's talk. Let's have a conversation. Let's talk about something. Let me teach you something that you may not know, but also teach me something that I don't know. You know, let's be constructive with one another and build each other up, not mean girl, break each other down. That shit is old and it's played out. Do you recommend using UWorld as well to study for NCLEX? So I think UWorld is okay. I think UWorld is okay. It just depends on what you need. Like, do you need content? Because UWorld doesn't give you that. They just give you questions, answers with rationales, and then some like small videos. Maybe you need like longer played videos. In my course, each content video is at least like 15 minutes long, going over, you know, specific topics. As a matter of fact, I just uploaded 7 videos this past week to include all 18 videos that I believe to be very important for NCLEX within pharmacology. So, like I said, once you get it forever for right now until like it's not there. So, but UWorld specifically, I think it's great that I think they're great if you don't need content. But I always try to tell people I would rather you get something that has questions, answers, rationales, content. That way you have a whole package rather than just getting questions. But if you understand content, go get you some UWorld. That way, all you need to do is just do questions and answers, you know. Archer is good for question practice. I agree. I actually like Archer a lot. I actually have a couple of friends that work at Archer. So, you know, a couple of networking events that I've been going to. So I actually like Archer. They're very, very, not only are they nice, but I like their business practices and stuff like that. I think it's really great. Griselda says, preach. Rosanna, you're welcome. But all right, what else you guys got? I'll hang out until about 7:30. I usually stay on here for about 2 hours. So, all right, but what else you guys got? Shout out to y'all that are in here. Make sure you guys go follow me on all those social medias. So Instagram, X, you know, Thread, of course here on TikTok, YouTube. Hey, and also if you missed the TikTok live where we're going through the questions and the answers, I upload all these videos onto YouTube. What is this? I don't know. I don't even know, like, what is what? What is what? J Travel Nurse BSN? That's kind of like knocking on somebody's door and be like, who live here? Like, what the Oh, my God. But, yeah, so what other questions y'all got? So, yeah, so right now we're doing an Ask Me Anything type of for nurses. New grad students, NCLEX takers, pre-nursing, all that good stuff. Great. Thank you. I'll look you up on YouTube. Yeah. So everything social media wise is the Boot Nurse, everything. So here on TikTok, Instagram, Facebook, freaking, YouTube, Thread, all that good stuff. Having trouble with my types of insulins. So the biggest ones that you need to understand are your fast acting, your intermediate, and your long acting. Right? You need to know your onset, your peak, and your duration. Okay, and then also you need to know the safety mechanisms or the safety that you need to provide as a nurse when it comes to that. Like if I'm going to give somebody Lispro, right? Lispro is what type? It's a fast acting, right? So what do I need to think about? Because what does insulin do? Right? It says BSN on there. I mean, I don't know. BSN. Did I say it like an asshole? I probably did say it like an asshole. My bad. But so with the insulin, it's like you got to know all of those things. And with insulin, it lowers your freaking your blood glucose, right? So now with food, with carbohydrates, I need to be able to. It's a balancing act, right? I don't want to send my patient. I don't want my patient to be hypoglycemic because they're going to look. Somebody who's hypoglycemic is like drunk in shock, right? They're in shock. Everything's going down. Stuff is going down. Other things are going to go up, right? They're going to get irritable, or they're going to get lethargic, but heart rate's going to go up, blood pressure's going to go down. So, stuff like that. It says no. Okay. I got you, Jay. I got you. Are you from Louisiana? Is that why you called the boot nurse? No, you're actually the second person to ask me that. I was like, no. So I call myself the boot nurse because I am in the military, and one of the biggest things that stick out within our military uniform is, of course, our uniforms are different, but it's also the boots. And the term boot that we say in the military is somebody who is brand new, that comes into the military that knows nothing about nothing. And I always say that in the military, we're always learning something new every day. It doesn't matter how long you have been in the military. I've been in the military for 16 years, but then if I switch positions, I'm still new there. So I'm a boot at this position. So I call myself the boot nurses because I am consistently knowing some new stuff every day. I call other nurses boots. I don't like the term baby. It seems kind of emasculating, maybe. I don't know. But anyway, so I'll use the term baby, baby nurse, boot nurse, whatever. So that's why I call myself the boot nurse. It's basically like the military aspect of it. But then also like, hey, we're new trying to acquire knowledge all the time, like, because you're not going to know everything. Same as nursing. Exactly. That's why I say same as nursing. It doesn't even necessarily have to be nursing. You can work in, IT spaces. You can work in, other management. You're just a novice. But just because you've been a nurse for 30 years doesn't mean that you know everything. Like if I put a computer in front of a nurse if I put a computer in front of a nurse to be like, hey, do this, who's been a nurse for 30 something years, who's not tech savvy, she's like, shit, well, now I got to learn how to do it. Now you're a boot at that. You know what I mean? So let me see what you said. Shaney said, do you think someone can be taken seriously as an educator with no bedside experience? I do. So if I was an educator and if I came with no bedside experience, you have to take a slice of humble pie at that point, to be like, hey, as an educator if I was an educator and I didn't have bedside experience, I would be like, hey, look, let's talk about, you can't go there and you can't be arrogant. You know what I mean? So, there's a lot of give and take. I mean, there's a lot of people that are, in educator positions who have never, ever, ever, ever taught bedside, but the thing about it is you're not going to come to me and talk shit and act a fucking fool. Because then I'm going to be like, how do you have this job and you don't even know? You know what I'm saying? So hopefully that answered your question. We call them Cherry and Airborne School. Ah, okay, I got you. See, I don't know nothing about Airborne. That must be an Army. That's an Army thing, because that ain't me. Why I thought you said the book nurse. No, I ain't that smart to be reading books. That's why I got Audible. So put them in front of a different exactly, right? Put them in front of a different medical record for sure, and they're gonna be like, what? So yeah, that's why I remember one time I was on my second deployment and I called this med surg nurse. She had been in the Navy not even 6 months or a year. She was on a deployment with us and I called her a boot and she got so offended because I called her a boot. And she's like, why am I a boot? And I was just like, because you don't know nothing about being out here. And she got offended. And I was like, you got offended? Why? Because I called you a boot? I was like, I ain't saying nothing about your nursing skills. I'm talking about you just being new here. And at that point, I think I was in for 6 or 7 years and she had been in around a year. She got real offended. I don't care about nobody calling me a boot. I'm like, you right. All right, if I'm a boot, hey, take me under that wing and let's get our learn on. Like, teach me something. Let's make it happen. All right. But coming up on 7:30. Appreciate all 25 of y'all rocking. We just went over some, ask me anything type deal, going over nursing questions. We did NCLEX questions. We do that every Monday, Wednesday, Friday at 5:30 Central Standard Time, all that good stuff. So I work ICU, but put me on the med surg floor and I'm lost. Facts. Right? I used to I worked ICU for a little bit over a year, and then I worked in the OR, and then I worked a little bit in the PACU. So, like I said, honestly, I loved the PACU. I thought the PACU was great. The nurses that were there, they were great, minus like one who, like, if she got like if an elephant stepped on her foot, I wouldn't give two fucking shits about her. You know what I'm saying? So, is it 19,000? It says, for me, it says 18.9. So I don't know what's going on there. You know what I'm saying? So, but yeah, I appreciate everybody being here. Same time, we'll be here Friday doing the same exact thing. We always start out with doing NCLEX questions. I'll do the short little plug. Make sure you guys go over there and follow me on all those platforms. Everything is at the Boot Nurse, everything. And you'll see my nice, amazing face. If you know of anybody that needs an NCLEX review, the 7-day NCLEX course, that link is in my bio. It is for $48 right now. Farah, thank you for the crown. I appreciate you. It's going for $48 right now in its pre-launch phase. But once the course is done, y'all, it's not going to be $48. I'm just letting y'all know. So just shout it out from the rooftops for people. And if you or anybody else need tutoring or need coaching on NCLEX, yeah, you can book a 15-minute call with me, and we can see if coaching is right for you. So with that being said, I appreciate y'all. I love y'all. I hope y'all are having a wonderful week. Be kind to yourself, because there's only one you. I don't give a fuck about nobody else. There's only one you, because if you can't take care of you, you can't take care of no spouse, no badass kids, no ungrateful motherfucker. Like, you can't do it. All right. So take care of you. Your mental health is the most important fucking thing on this goddamn planet. Sorry if I'm swearing too much for y'all, but I'm just letting y'all know, if y'all can't take care of you, you can't take care of nobody else. And that's facts. All right. And hey, look, Jen, I'm always taking care of me. Always. I come before, because I can't be the best. I can't be the best person, best nurse, best educator, best motivator, best father, best spouse. I can't do none of that. I can't do nothing like that unless I take care of me first. So there's that. Like I said, hope you guys have a wonderful next couple days. I will see you guys on Friday. Like I said, love yourself, be kind to yourself. You only got one of you. All right. And like I said, if anybody needs any help, y'all know where to find me. So until then, I will see you guys on Friday. Bye.